One minute your cat is perched on the windowsill looking perfectly fine, and the next you hear that awful wet gulping sound from the other room, sprint over in your socks, and find a fresh puddle on the carpet with a shocked little cat standing beside it like nothing happened. If that scene feels painfully familiar, you are not alone. And the hard part is this. Sometimes vomiting is a fairly minor issue, and sometimes it is the first clue to something that needs attention right away. I am Dr. Leo Tran, your neighborhood vet, and today I want to help you tell the difference between the occasional upset stomach, the classic hairball situation, and the one sign, or really the cluster of signs, that means your cat should be seen by a veterinarian now. The reason vomiting causes so much confusion is that cat owners hear mixed messages all the time. Some people are told cats just throw up now and then. Some people assume every vomit is a hairball. Some people switch foods 3 times in a month and hope it goes away. Meanwhile, the cat may be dealing with something simple like eating too fast, or something more complex like food sensitivity, inflammatory bowel disease, parasites, pancreatitis, kidney disease, a swallowed string, or even stress that is affecting the stomach and intestines. So, let us start with a distinction that matters more than most people realize. A hairball is not the same thing as true vomiting, even though one can lead to the other. A true hairball episode usually involves a cat bringing up a tube or clump of hair, often mixed with a little fluid or food. True vomiting is the forceful expulsion of stomach contents or fluid, with abdominal effort, heaving, and a puddle that may contain partially digested food, bile, foam, liquid, or blood. Then there is regurgitation, which is different again. Regurgitation is more passive. Food seems to come back up soon after eating, often in a tubular shape, with less heaving. Owners frequently call all 3 things vomiting, but the details help your vet narrow down the cause. If you can picture what happened, think about timing and appearance. Did your cat eat very fast and then bring up undigested food within a few minutes? That leans more toward regurgitation or fast eating. Did your cat do the classic crouch, swallow repeatedly, heave several times, and then bring up yellow liquid or mushy food? That is more consistent with vomiting. Did you find a damp hair cigar on the rug with a little fluid around it? Hairball likely played a role. These are not perfect rules, but they are very useful clues. Now, why do cats vomit at all? One simple answer is that the feline stomach is very good at ejecting things it does not like. Cats are sensitive creatures with fastidious habits, but they also groom constantly, swallow fur, nibble plants, steal treats, bolt food, and experience internal diseases that can irritate the digestive tract. The stomach and intestines respond to irritation in a limited number of ways, and vomiting is one of them. One of the most common everyday causes is eating too fast. A hungry cat rushes to the bowl, swallows large amounts of food with air, and the stomach basically says, "No, thank you." This often happens right after meals. You may see mostly undigested kibble, or food that still looks like dinner rather than something partly digested. Another common cause is a sudden diet change. Cats do not always appreciate abrupt switches. Even a food that is high quality can trigger vomiting if introduced too quickly. Table scraps, rich treats, flavored medications, and raiding another pet's bowl can do the same thing. Hairballs are another frequent player, especially in long-haired cats, heavy shedders, meticulous groomers, and cats who overgroom because of anxiety, itchiness, or pain. Fur is not digestible. A normal amount usually passes through the intestines, but if enough accumulates, the stomach may try to expel it. The key point is that frequent vomiting should not simply be dismissed as hairballs forever. If your cat is vomiting more often than occasionally, there may be more going on than fur alone. Then there are the medical causes. Food sensitivity can lead to chronic stomach and intestinal irritation. Inflammatory bowel disease, often shortened to IBD, is a condition where inflammatory cells build up in the digestive tract, causing vomiting, diarrhea, weight loss, and appetite changes. Parasites can cause vomiting, especially in younger cats or cats with outdoor exposure. Pancreatitis can cause nausea, pain, lethargy, and reduced appetite, though cats can be very subtle about it. Kidney disease can make cats nauseated and lead to vomiting. Hyperthyroidism in older cats can cause weight loss, increased appetite, and sometimes vomiting. Liver disease, toxin exposure, constipation, dental pain that affects eating, and swallowed foreign material can all land on the list too. And this is exactly why common fixes so often fail. Many owners respond in ways that make sense at first, but do not solve the real problem. The first common fix is assuming every episode is a hairball and buying a hairball remedy without asking why the vomiting started. If a cat actually has IBD, pancreatitis, kidney disease, or a partial blockage, a hairball gel may do absolutely nothing. The second common fix is changing foods too often. When owners panic, they may go from one brand to another, then to a grain-free diet, then to a sensitive stomach formula, then to canned only, all in a short span. That can make the digestive tract even more unsettled and muddy the picture. The third common fix is fasting a cat too aggressively. In dogs, people are sometimes told to rest the stomach for a while. Cats are not small dogs. Extended fasting is not ideal, especially in overweight cats or cats who already do not feel well. Cats that stop eating can get into serious trouble with fatty liver disease, also called hepatic lipidosis. The fourth common fix is watching and waiting for far too long, because the cat still acts mostly normal between episodes. So, what is the real fix? It starts with pattern recognition and knowing the emergency signs. Your job at home is not to diagnose every cause. Your job is to notice what came up, how often it happened, what your cat is doing the rest of the day, and whether any red flags are present. The real fix is separating occasional, mild vomiting in an otherwise bright, eating, normal cat from vomiting that is frequent, worsening, or paired with signs of systemic illness. Here is the big emergency message I want burned into your memory. If your cat has repeated retching with little or nothing coming up, or repeated vomiting over a short period, especially along with lethargy, refusing food, blood in the vomit, abdominal discomfort, or trouble keeping water down, that is a veterinary visit now, not later in the week. Repeated retching matters because it can signal severe nausea, a foreign body, or an obstruction. Blood matters because it can indicate significant irritation, ulceration, toxin exposure, or worse. Lethargy matters because a cat who is not just quiet but truly weak, withdrawn, or hiding is telling you something bigger is happening. Not eating matters because cats can decline faster than many people expect. There are a few more urgent signs to add to that cluster. A distended or painful belly, vomiting after known toxin exposure, like lilies in the house, human medications, rodent bait, or certain essential oils. Vomiting in a kitten, a senior cat with chronic disease, or a diabetic cat. String hanging from the mouth or the rear end. Do not pull it. Cats who cannot keep even water down. Black coffee ground looking material or bright red blood. Pale gums, collapse. These are not home care situations. Now, let us talk about the more common scenario, because most vomiting episodes owners see are not midnight emergencies, but they still deserve smart handling. If your cat has one mild episode, is otherwise acting normal, still interested in food, walking around comfortably, and the vomit looks like food, foam, or a small hairball without blood, you can often do some simple observation and supportive steps while staying alert for changes. Start by asking, when did it happen in relation to a meal? If it happened right after eating and, your cat inhales food, speed is a top suspect. The fix there is mechanical and very effective. Feed smaller meals more often. Use a slow feeder bowl, a puzzle feeder, or spread the food over a larger flat plate so your cat cannot shovel it down in 1 minute. Some cats do better when a daily ration is split into 3, 4, or even more mini meals. If there is competition in a multi-cat home, separate feeding areas can help, because anxiety and food guarding make cats eat faster. If the vomiting seems tied to hairballs, think fur management, not just hairball paste. Brush regularly, especially during shedding seasons. Long-haired cats often need more grooming than owners realize. Make sure skin problems are not driving excessive licking. Fleas, allergies, pain, and stress can all increase grooming and therefore hair intake. Encourage hydration with canned food, water fountains, or extra water added to wet meals if your cat accepts it. Good hydration and gut motility help fur move through the system. Some cats benefit from a veterinarian-recommended hairball diet or fiber adjustment, But more fiber is not always better for every cat, so this is worth tailoring rather than guessing. If a diet issue seems possible, avoid chaotic food changes. Transition gradually over at least 7 to 10 days, unless your veterinarian directs otherwise. If your cat has recurrent vomiting, random over-the-counter experimentation can actually delay diagnosis. A proper diet trial, especially for suspected food sensitivity, usually has to be strict and consistent for weeks, not days. That means no flavored treats, no table food, no sneaky bites of the other cat's dinner. When should recurrent but not emergency vomiting still be checked? If your cat vomits more than once every week or two on a continuing basis, if there is weight loss, appetite changes, diarrhea, constipation, poor coat quality, increased thirst, behavior change, or if your gut tells you this is becoming a pattern, it is time for a workup. Chronic vomiting is common in cats, but common does not mean normal. A cat who throws up just once in a while, but does so every week for 6 months, deserves more than a shrug. What does a vet workup typically involve? First, a history. Your description matters tremendously. Bring photos if you can. Note frequency, timing, hairballs versus food versus foam, and any change in appetite or stool. Then, a physical exam. Depending on the case, your vet may recommend fecal testing for parasites, blood work to look for kidney disease, liver changes, thyroid issues, dehydration, inflammation, or metabolic problems, and imaging such as X-rays or ultrasound to look for foreign material, constipation, masses, or bowel thickening. In chronic cases, ultrasound can be especially helpful. Sometimes specialized blood tests, diet trials, anti-nausea medications, probiotics, or endoscopy and biopsies enter the picture. The point is not that every vomiting cat needs everything. The point is that the causes are broad and guessing has limits. Let me give you a practical home framework. If your cat vomits once and then acts normal, you can observe closely. Offer water, feed the next meal in a smaller portion. Watch for another episode. If there is repeated vomiting, if your cat seems off, if the vomit contains blood, or if your cat refuses food, call your vet the same day. If there is repeated retching with little produced severe lethargy, signs of pain, or an inability to keep water down, go urgently. When in doubt, especially with cats, I would rather you call earlier than later. There is also an important caveat about anti-nausea medication and human remedies. Do not give human stomach medicine, pain relievers, or leftover pet medication unless your veterinarian specifically told you to. Cats process drugs very differently from people. Some medications that seem harmless can be toxic. And if the issue is a foreign body, simply suppressing symptoms while the obstruction worsens can be dangerous. Another caveat is that vomiting can look like coughing to some owners, and coughing can look like vomiting. A cat hacking low to the ground with neck extended may be coughing up airway mucus rather than stomach contents. Asthma can be mistaken for hairballs for months. If what you are hearing sounds more respiratory than stomach-related, or your cat has any breathing change, that is a different lane and should also be checked. Molly had vomited once or twice a week for nearly a year, sometimes food, sometimes foam, occasionally a little hair. She still purred, still followed her owner to the kitchen. And because the episodes were spread out, they had become part of life. But Molly had also lost 1.5 pounds, and in cats that matters. Her blood work gave us some clues, and her ultrasound showed intestinal changes that fit chronic inflammatory bowel disease. Once we stopped chasing random foods and built a real plan with a prescription diet and the right medications, her vomiting dropped dramatically, her appetite steadied, and her owner later told me the house felt calmer because she was no longer bracing for cleanup every few days. The lesson was not that every vomiting cat has IBD. The lesson was that repeated vomiting is information. Now, let us knock down a few myths, because these myths keep good owners stuck. No, cats do have a remarkable ability to vomit, and yes, an occasional isolated episode can happen. But frequent vomiting is not a normal feature of healthy cat life. If it is happening regularly, there is a reason. Also no, a cat can vomit because the stomach is irritated for another reason, and still include some hair, because cats are always swallowing some fur. Hair in the puddle does not prove hairballs were the whole problem. Cats can continue eating during early disease, and some conditions cause nausea one day and appetite the next. Also, some cats will approach food because they want to eat, but then feel sick after. Appetite is just one piece of the puzzle, not the entire puzzle. Better ingredients can matter in some cases, but vomiting is a symptom, not a diagnosis. A premium diet will not remove a swallowed string, cure hyperthyroidism, or settle severe IBD on its own. So, how do you reduce everyday vomiting in the average cat household? Feed measured meals and slow down fast eaters. Use wet food when appropriate to support hydration. Brush routinely, especially if your cat is long-haired or grooms heavily. Keep strings, ribbon, thread, tinsel, rubber bands, and hair ties completely out of reach. Introduce any new diet gradually. Keep parasite prevention current if your veterinarian recommends it. Reduce feeding competition in multi-cat homes. Pay attention to stool quality, body weight, and appetite, because the stomach and intestines tell a story together. And keep a simple vomiting log if this has become a repeat issue. Date, time, what it looked like, relation to meals, and how your cat acted afterward. That little note in your phone can save days of guesswork. One more thing I want to say for owners who feel guilty after hearing all this. Please do not beat yourself up if you have been calling it a hairball problem for months. Cats are masters of appearing okay until they are not. The goal is not perfection. The goal is to notice patterns and respond wisely. If today is the day you stop normalizing weekly vomiting, then today is a very good day for your cat. So here is the whole message in one breath. If your cat vomits once in a while and otherwise seems bright, eating, and comfortable, think timing, hairballs, diet, and speed of eating. But if there is repeated retching or repeated vomiting, blood, lethargy, refusal to eat, pain, weight loss, trouble keeping water down, or anything about your cat that feels truly off, that is your sign to call the vet and get help sooner rather than later. If you want more clear, practical cat health guidance without the panic and without the guesswork, subscribe and stay with me here on Dr. Cat. Because the more you understand what your cat is trying to tell you, the safer and easier life gets for both of you. Until next time, give your cat a gentle brush, a slower dinner, and a little extra attention